Well, the World Health Organization has said that the UK COVID variant has spread to more than 70 countries and the South African strain can now be found in 31 countries. Yet, many experts continue to say that the vaccines can grant us at least a certain degree of protection against the virus mutations. Today on the show, we'll try and break down for you how exactly do vaccines work and how will they protect us against the variants. Well, vaccines create multiple types of antibodies against the coronavirus. Experts say that these multiple types of antibodies essentially guarantee us protection against the mutation. And if not antibodies, then T-cell immunity lasts much longer even when the level of antibodies goes down. Now, there are also memory cells that are generated with the vaccine that produce antibodies when the body is encountered with the coronavirus. Every mutation, experts say, doesn't essentially change the behavior of the virus. Some mutations might, but not every mutation does. The vaccine can protect you against a severe disease that is caused by the mutation. So once you've been vaccinated, you may still be able to contract the coronavirus, but the chances of getting a severe infection are less even with a mutant strain. Now, what really is the vaccine strategy against the variants? What should be the global strategy? Well, experts say that it is key to vaccinate as many people as we can in a short span of time. Herd immunity needs to be achieved not nationally, but in fact globally. Preventing the spread of the coronavirus is key to containing mutations and preventing mutations from developing in the first place. And therefore, it is important to continue to use protective measures even after you have received the vaccine. So, masks and social distancing clearly not going anywhere. To explain more and talk more about how vaccines work, we have Dr. Vincent Rajkumar, MD, Editor-in-Chief, Blood Cancer Journal and Professor of Medicine at the Mayo Clinic, joining us from Minnesota. Thanks so much for being with us. I want to begin by asking you about the variants and the big question on whether vaccines will be effective against them. Can you begin by explaining to our viewers what happens when you get vaccinated?
Sure. When you get vaccinated, you're getting exposed to, depending on the vaccine, the actual spike protein or the actual virus. And the body's immune system is trained to attack that. And what the body does is makes antibodies. And these antibodies are not against just one portion of the spike protein, but multiple different spike portions. And therefore, we generally generate a whole portfolio of antibodies. And so that even if there is some variation, some of the other antibodies can still work.
So the vaccine, you're saying, will essentially be able to give us protection against virus mutations, right?
Yes, I think if we step back and look, as I talked to you about basic immunology, I think vaccines will still have a pretty significant effect. And there are two ways of looking at it. One is that, as I mentioned, we make a portfolio of antibodies against various portions of the virus or the virus spike protein, so that even if there is one mutation, the chances are that some of the other antibodies that are generated would still work. The second point is that normally when we try to make an antibody against a virus or a new protein, it's like making multiple antibodies trying to see which one would actually fit. It's like making many, many keys to a given lock, so that the other keys are not perfect for that particular lock, but if the lock changes, one of the other keys might likely fit. So there's a lot of redundancy built into the immune response that sometimes cannot be even measured, but the cells that make these antibodies are still around. The other point is that we not only make cells that make antibodies, but we also generate what are called T cells. This is a different portion of the immune response, and that also offers some redundancy. And then finally, an antibody or a T cell response may not be able to, completely prevent you from having COVID if the virus has mutated substantially, but it will still protect you from probably severe disease, right, because it's still going to give some cross immunity or cross-reactive immune coverage.
Right. But, the question then is, it's been said that in case of the Moderna vaccine, for instance, that it gives you protection against the UK strain. but 6 times less effective against the South African strain. What explains more protection against one strain and less protection against another?
Yes, and that is somewhat harder to answer with lab studies, because in lab studies, they're looking at, say, neutralizing antibody titers and how effective they are at a given strain. So the Moderna vaccine is 6-fold less effective, but it's still effective. I mean, because the titers are so high that even a 6-fold drop is still enough, far more than what you need to completely neutralize the virus. But that's still a lab test. It doesn't tell you what happens in real life. In real life, it will take some time to figure out if some of these vaccines don't really work against some of the variants, and whether some kind of booster or a modified vaccine is needed, say every year or two, to counter this. My big point, however, is that the faster we get most people vaccinated, the less hosts there are for the virus to mutate. And that's really the main message, is that, and you have to look at the whole world as one, because it doesn't matter if the United States is protected if mutants are happening in Africa. So as long as there's worldwide travel and an interconnected world, it's really important that everyone takes the challenge of vaccinating the public, regardless of countries, and reduce the number of hosts that are available for this virus to mutate.
Right. It's very interesting that you talk about one world when it comes to vaccines, especially to look at long-term protection. It's very important what you say in the context of vaccine nationalism currently. But since we're trying to understand how the vaccine protects us, we've been told that you have to still continue to wear your mask, maintain social distancing, even after you've been given the shot.
So it's not the vaccine is 6-fold less effective. It's just that the titers are lower. The neutralizing activity is lower. So I think that distinction has to be kept. But again, the reason we are saying everybody still needs to wear a mask, even if they're vaccinated, is the unknowns. We don't know certain answers, like, are vaccinated people still able to get the infection, and then are they able to transmit the infection? Those are difficult to prove, and we just assume they are, just in the interest of being safe. And as time evolves, we'll know a little bit more about it. Similarly, the second reason why we are doing that is that the vast majority of the public is still susceptible. As the number of people who are vaccinated increases, then we don't need to wear masks if most people are immune, either by virtue of having had a vaccine or having had COVID. So there is a gap of a few months that everybody needs to be patient. And like I have had two doses of the Pfizer vaccine, but I'm still wearing a mask because I really don't know whether I'm very comfortable that I won't get sick or die from COVID, but I'm not sure that I will not get COVID and pass it on. So we just want people to be careful,
right,
because of the unknowns,
okay,
and assume that you're infectious. And it'll be only temporary till
right,
we vaccinate a huge segment of the public.
Right. Interesting. You've got the Pfizer vaccine. Do you know just yet if you need to get it again? How long does vaccine immunity last, for instance? Are we any closer to getting some of those answers?
I think we will know with time, because as a substantial number of people get vaccinated in a country, you will start seeing if there is an effect. For example, I think Israel might give you a good view on that. Already 40+% of that country is vaccinated. Now, if some of the vaccinated people start getting the Brazil strain or the South African strain, then you will start thinking, well, maybe we do need a booster. That's the kind of real world data that is lacking. What we have is only lab data. So I think time will tell. But, the flu vaccine is somewhat different because there are many, many different types of flu viruses, and some strains circulate in some years and some don't. And the mutation rate and this extent of mutations is more than with SARS-CoV-2. So I don't think we can readily extrapolate to flu and assume that you need an annual vaccine, but some kind of a booster down the road to account for
right,
some of these more transmissible or lethal variants may be needed, but time will tell.
Right. The mRNA vaccine technology is said to be more flexible when it comes to tweaking vaccines. Does that put India at a disadvantage?
Actually, all these technologies are new in large scale. And so who knows? I think the adenoviral technology that's used for the Oxford vaccine can be easily used. Similarly, the inactivated vaccine technology is also something that can be easily modified. The question is whether regulators will want phase 3 data for every modification that you make. But I think taking a strain that is more lethal and inactivating it for use as a booster should be just as easy as modifying the mRNA. I don't think one technology, again, is more amenable to modification as the other. It's only what regulators would need because of the change that is made.
Yeah, it's going to be interesting to see if, if every change is actually going to need regulatory approval and how that plays out. But thanks so much, Dr. Vincent Rajkumar, for sparing your time and being with us on NDTV.
Thanks so much for having me. My pleasure.
Well, the Union Health Minister has said that 18 districts haven't seen a fresh case of COVID-19 in the last 14 days. And no new case of the coronavirus has been reported in 147 districts in a week in India. More good news, well, Delhi's daily COVID cases have fallen below the 100 mark for the first time in 9 months. And if that's not good news enough, well, there's more coming your way because the Health Ministry has issued guidelines in which swimming pools will be permitted for use for all from the 1st of February. Cinema halls and theatres can operate at a slightly higher seating capacity than what was previously permitted. There are going to be no restrictions between inter and intra-state travel as well. But remember, the mutant strain of the coronavirus from the UK has been found in India, over 150 cases already. Are these, reasons to celebrate or cause for caution? We have Dr. Hemant Deshmukh, Dean of the KEM Hospital, joining us from Mumbai. And we have Dr. Sumit Ray, the Head of Department Critical Care Medicine at the Holy Family Hospital, joining us from Delhi. Thank you, gentlemen, for being with us. I want to begin, by asking you, Dr. Hemant, if I can, the good news is not so much from districts in Maharashtra is what we're learning. Maharashtra and Kerala still have cause for concern. How are you looking at these developments, what the Health Ministry has said today and the relaxation of the rules?
Yeah, depending on the relaxation of the rules for a shutdown, what we are planning to do is we are always anticipating any kind of increase in surge of a COVID positive patient. So we are not shutting down the facilities for treatment of either a mild case or a moderate case or a severe case. So any unexpected spike in the number of cases, I think we are ready to treat them, we are ready to isolate them, and we are ready to definitely see to it that the transmission is reduced. We are always ready to see to it that we break the chain of transmission of these residents who are coming from outside Mumbai. And therefore, any good news for them is obviously lesser good news for us as treating physicians. Right.
Dr. Sumit Ray, which way would you look at this new data that's coming in? You know, certain districts haven't seen cases in over 14 days. This is extremely good news. But what explains the fact that, you know, India's cases are dipping the way they are?
Right. It's good news for sure, but we have to be watchful. And, you know, it's important, like Delhi has done the seropositivity tests, and to be watchful, do tests in larger urban centers and look at the seropositivity rate. As your previous speaker in Dr. Natarajan from Mayo Clinic said, vaccination is one element of it, but if already seropositivity is more than 50%, as in many districts of Delhi, so a combination of vaccination and this kind of testing could help us identify areas where the possibility of transmission is less.
Right.
And it cannot be a generalized opening up of everything across the country. It has to be area, region specific, I think. And I think still now we have to be watchful and in public health measures in terms of mask, etc. But also the fact is, do we really need to accept areas where clear-cut seropositivity has shown that the chances of transmission are less? Do we really need to open up completely the swimming pools or completely the cinema halls,
Yes.
etc.? Education, I can understand. Entertainment, I know it's important, but probably we have to be much more careful at this point.
So you're still treading on the side of caution at the moment. Dr. Deshmukh, would you agree? Because, you know, there is a threat of the mutant strains of the coronavirus that have proliferated across countries in the world, including here in India. In the midst of that, you know, are these restrictions being lifted? Is it welcome?
They're not totally welcome as such, but this mutant strain can be a tip of the iceberg also in India. What we are seeing right now is a very small number, but the moment each small number tries to transmit the disease to a larger percentage of people, then it's definitely a cause for concern.
Yes.
I would be very guarded there. I would keep my eyes and ears open, and we are ready to tackle any kind of emergencies if they arise.
Right. Dr. Ray, you know, if I can ask you that the other big question at the moment is, of course, you know, around vaccination. Now, here also, as far as the numbers are concerned, India is doing well. We've already surpassed some major nations of the world in terms of the pace of vaccination and the daily vaccinations that are being carried out. However, there are still a certain section of experts who believe that we need to be vaccinating much more per day than we are to meet our own targets, in which case, you know, vaccinations should start happening at private hospitals. It should be made available in the free market as well. What are your views on that?
No, I don't think it should be made available into the free market at all yet. I think it should be a public health process controlled by the government at this present moment. And I have questions about, I mean, yes, we should hasten the pace for those with comorbidities and risk of severe disease. But do we really need to vaccinate our whole population? There are two schools of thought on that. And I believe in the other school of thought that if we can keep checking on the seropositivity, if you focus on those regions and in the younger population, etc., if the seropositivity rate is high, do we really need to vaccinate them is a big question, because we don't know for both seropositivity and vaccination, how long is that going to sustain itself, the antibodies? Even for vaccination, we don't know. So should we be spending so much money on vaccination when we can ourselves be developing the immunity to it? Okay. Yes, people with high risk, comorbidities, etc., understandable. We should go for early, fast vaccination for them. Also, the fact is that we have to be watchful for the fact, as the professor from Mayo Clinic said, that we have to be watchful if the mutant is blocked by the vaccine or not. If we give vaccination to everybody and then down the line we find that a mutant is not blocked by the vaccine, or we need to add a dose or need to tweak the vaccine, so we have to constantly watch that element too. So I don't think we should be rushing to vaccinate the whole population, but focusing on those with high risk and comorbidities and constantly getting data about seropositivity and regional data, localized data, and the national data.
Right. And Dr. Deshmukh, would you agree, you know, is our vaccine dissemination strategy prudent, or, you know, do we need to constantly also be reinventing basis seropositivity data, basis genome surveillance?
The whole idea of vaccinating a population, this is definitely divided into three phases of healthcare workers, then the frontline workers. The idea behind this is to increase the immunogenicity amongst the population itself, so that even if you immunize, say, 60 or 70%, that's a huge number for us. And once you immunize more than 40% of the population, a point will come where the general immunity amongst the population will increase, and the transmissibility will definitely decrease to an extent where you will not be able to transmit a disease so easily, which is happening. Yeah.
I'm completely out of time, but Dr. Ray, very last word. Would you recommend going to a swimming pool come 1st of February once it's allowed to reopen?
Well, it's too cold as it is.
At least in Delhi, it's too cold. Okay.
Yeah, it's too cold. But I think, you know, in terms of entertainment and swimming, etc., I think we should hold back for this, except in certain regions where there is seropositivity high and transmission is less, then we can do that. Yeah.
Dr. Deshmukh, would you agree?
Yeah, definitely agree. It should be a guarded opening of these swimming pools. I don't know, that's not the first priority right now anyway.
Yes,
all right.
Absolutely.
All right. Thank you so much, doctors, for sparing your valuable time and being with us. We're going to slip into a very short break. Coming up on the other side, we'll answer your questions on the coronavirus. Stay with us. Back, it's time that we take your questions on the coronavirus. Dr. Rakesh Chawla, Senior Consultant HOD Respiratory Medicine from the Saroj Super Speciality Hospital, joins us. Thanks so much, Dr. Chawla. Arya from Delhi has the first question.
नमस्कार, मेरा नाम आर्य है, मैं दिल्ली से हूँ। मेरा सवाल यह है कि बच्चों को वैक्सीन लगाने को लेकर क्या फैसला लिया गया है? क्या बच्चों को वैक्सीन लगाई जाएगी?
All right, Dr. Chawla, will children be getting the coronavirus vaccine anytime soon?
Yeah, already corona vaccine is available in the country. There are 2 vaccines which are people are being vaccinated with Covaxin and Covishield. But the recommendation is from 18 years old and above. For children, still the trials are going on in United States of America. Still there are no guidelines to vaccinate the children.
All right. Shaurya from Delhi has the next question.
नमस्कार, मेरा नाम शौर्य है और मैं दिल्ली से हूँ। मेरा सवाल है कि यूके का जो नया वेरिएंट है, उसका बच्चों पर किस तरीके का असर देखने को मिल रहा है?
All right, Dr. Chawla, UK variant and the effect that it has on children.
Okay. See, not only the UK variant, which is 501YY1, is there, apart from this African 501Y2 and Brazilian 501Y3. So these are the 3 variants which have been picked up by the international system, and they are more, say, virulent than the present coronavirus strain.
Right.
But the issue is, in the virus, like influenza virus, there are antigenic shifts and antigenic drifts. But coronavirus does not have the antigenic shift. That is a plus point. And since our population is being vaccinated, the chances of Indians to get the virulence of the mutants is at present very low. The way the government of India has acted, the way they have isolated these 150 people who are suffering, I think still there is nothing to worry at present.
Okay.
And it has been identified in adults, not in children.
All right. Appreciate you for joining us with that perspective.